Welcome, everybody. My name is Jenny Peck. I'm from the fundraising team here at Amref USA. I'm really glad that you guys could all make this very exciting and interactive supporter call around the topic of climate and health. I think something that's garnering a lot more attention these days and something that is very important to us all. We have many of our offices coming together. This session is bringing together supporters in the US, in Canada, in UK, in Kenya, in Tanzania, and I'm sure some of you guys are elsewhere. And so we just wanted to say welcome and thanks. Over this next 40 minutes, we have our wonderful colleagues from Amref Kenya and Amref Tanzania to talk with us about Amref's innovative approaches to building sustainable and healthy communities capable of withstanding the adverse effects of climate change. So I want to make sure you guys know who our speakers are. So I would like to introduce Dr. Martin Muchangi, the Director of Population Health and Environment. He's waving his hand. He's at Amref Kenya. And then Engineer James Mturi, the WASH Program Manager at Amref Tanzania. James, can you, right there, great. So those are our speakers, and our wonderful moderator today is Amref USA CEO, Bob Kelty. So Bob, I hand it over to you.
Thank you, Jenny, for the warm introduction. Really a pleasure to have everyone and getting a chance to talk about climate and health. I think a lot of times people's initial reaction when I start talking to them about Amref doing climate work, they're kind of like, why? Which I think says it all. It's not really been until the last couple of years it's been a topic on people's mind, and even thinking about the connection between the two, which if you do any thinking at all, it's really an obvious connection. And I think, this year, I think 4 or 5 years, I know Martin, you probably can tell me exactly, we really just have been working on it for about 3 or 4 years. It's really making the connection and really having conversations with major foundations, with the U.S. government, other multilateral donors, and I think this was a big break for you. The annual UN environmental conference called COP28 was the first time there actually health was on the agenda in an official way. So I think people are making a lot of connections to it, and I think Amref, we're really proud of the work that we have done on driving that agenda, and both Martin and James have been a big part of that. And you'll hear them say much more interesting things than I have to say. But I think one of the things, though, because we have a lot of people from the North on the call, is what are the challenges of climate in Africa, and how do they think about it? I think from the wealthy countries in northern, we're always thinking about mitigation, where people mostly are thinking about adaptation in Africa and how to make the systems more resilient. And I think Martin's going to go much deeper into that. But there is also, because right now Africa only has 3% of the carbon footprint globally, yet it's being hit probably hardest than any other continent there. And so, but there is a great opportunity, and James will go in this, is, right now we don't have a large carbon footprint there, but there is going to be this transfer, and he's going to talk a little bit about energy and energy usage, like we have, because we're still at so many, he's going to be talking about use of coal fire cooking, or for burning and cooking, and it's like there is just going to be big transformational, as we know the African continent is going to be having tremendous economic growth over the next 20 to 30 years. If there is an opportunity to transfer over to clean energy, or not even transfer over, as their industry or as manufacturing increases. So it's a really exciting opportunity for Africa. But one of the biggest challenges, and Standard Bank actually did an article about this, or a study about it, that how little money was going in adaptation in Africa, or even in across India and Asia also, on adaptation, and that really philanthropy and governments aren't going to be the ones who make the change in adaptation and building resilient systems. And it's really going to have to be private, funding. Corporations, businesses are really going to lead the way in Africa on doing the adaptation. So I think that's all I'm going to do for now, and I'll let the experts talk. And I guess we'll start with Martin. Um, and so, Martin, what does climate resilience mean to our audience who might not know the term, and what do you identify as critical elements of building climate resilience communities Amref is working in?
Thank you so much, Bob, for having us here. Thank you, colleagues. Let me begin by painting a picture of what climate change is to health. Climate change is a major disruptor of the health services, and it touches both the community health where we live, and it also disrupts the health services where we receive treatment, that is at the hospitals. And we see this happening through major things. Sometimes you have floods, and sometimes you have droughts. And through that, communities' food systems are disrupted, which means they don't have good enough food for their nutrition. And that's just one simple example. So when we are talking about community resilience, it is that action or a set of actions that help communities to bounce back to their normal lives. And in this case, we are talking about health. So in many circumstances, you have realized that when such kind extreme climate events happen, when there is floods or droughts, then there is major disruptions of livelihoods, the way people live, and all that. So Amref Health Africa, together with its partners and stakeholders, especially the government, have been working to address the immediate impacts of climate change, such as displacement, lack of food, lack of water, and all that, and also the long-term kind of perspectives. And I would want to point out some of the key things that we have been doing systematically. I began by saying government engagement, working with government. So we work very closely with the government, first of all, to ensure that we have coordinated actions so that all the partners are like working in synergy. So that's point number one. Point number two, it's all about co-creating solutions that are impactful to the communities and that make sense both to the government and to the stakeholders like Amref and also the community itself. And then thirdly, it's just ensuring that we are able to measure ourselves, see how well we are also moving. If you take resilience from 0.0 to 100%, we always keep checking each other. So that accountability mechanism. So that's point number one. Point number two is around working with communities themselves. We have realized that the power lies with the communities. That's where actions happen. That's where empowerment happens. So we work very closely with the communities, including the community health workers, to ensure that, first of all, awareness is created. And then number two, whatever the communities need to do, they are able to do for themselves. And so for that case, we see a lot of sustainability building around the mechanism of working with communities. Then the other thing is we strengthen health systems, and we strengthen health system by introducing novel, innovative methods of and developing early warning systems. So we work with community health workers to collect both climate data and the health data. We help them to put it together. And we have platforms that we have been using to transmit that data in a way that decisions can be made in a timely manner. And then the other key issues is around working around ensuring that the basics are met. And the basics is water, sanitation, and hygiene. So we ensure that we put systems that enable communities to be able to access basic water, sanitation, and hygiene services even when these disasters are striking. And then lastly, and the most important thing, is to think about how communities make their money, how they live. So we work to strengthen their livelihoods. And for this case, where I come from, we do work with agriculturists and pastoralists, ensuring that we have safety nets and we have systems that can ensure that even when these shocks hit, then they can be able to bounce back in a better way. Thank you, Bob.
Thank you, Martin, for that. Could you give us maybe a concrete example? We've had the recent floods in Kenya. Maybe a concrete example how Amref works on building climate resiliency, and also how respond when there's a crisis.
Yeah, sure, Bob. And I would want to say that we come through in two ways. First of all, as first responders, number one. And then number two, also we come very strongly in terms of building resilience. Now, taking the example of what happened in Kenya, we just came from a very, very bad drought situation. And all of a sudden, we got into some flooding situation. Most of the areas of the country were actually underwater. And so what we did, and very quickly, was to imagine the situations that we needed to advance within the communities and how to work with the government to ensure that the basic services are actually advanced. One of the key examples is there was a gap in terms of reporting and being able to understand exactly where the problem is. And so we moved in, built the capacities of health workers to collect data and report using mobile phones. And so that data was synthesized. It was used to develop some sort of early warning systems and to help the response moving forward. So, and we see this as one of the key innovations that we need to keep on maturing and also expanding. So there are platforms. One of them is called Mturi. Mturi is a platform which communicates to the communities using short messages. And so once that data is keyed in, we understand what the situation is going to look like. It is much easier to send short messages to communities to warn them, to alert them. So that is one of the examples, and we see this, if we build this moving forward, we are likely to build some sort of resilience to future kind of shocks if they happen.
Thank you, Martin. So just a little bit about, I know you've been working on, and the whole team in Kenya has been working on our, what we call our new approach of One Health. Kind of just give a little bit why we're thinking in this direction, and how kind of why we've made this switch, or actually built on work we've done a long time ago in the pastoral communities, and kind of what are the impacts from it.
Thank you once again, Bob. So again, let me paint the picture of the challenge here. In many circumstances, most of the interventions have been siloed. So you go and do one thing, and then another partner comes and does another thing. And that way we are not so efficient in terms of cost and also in terms of impacts that we create. So Amref has been working together with the stakeholders to implement the One Health approach. And One Health approach means addressing environmental health, human health, and animal health all together. And the reason that we put all this in a connected way is because of the context in which we live. So if the animal health is not proper, then zoonotic diseases, or diseases which come from animals to human beings, are transmittable. And so we found it fit to work with the different sectors, agricultural sector, the veterinary sector, coming together with the environment sector, and coming together with the health sector to build a system which addresses the common problems in communities in a way that we can address climate change issues sustainably. And so for that case, this model is working very well in Kenya and South Sudan, and we are expanding this to other countries as we continue building the system and refining the methodology. And so what we do is, when we go to the community, we go with veterinary services, those who provide veterinary services. They treat the animals, and at the same time, the healthcare workers see the patients and also give information to patients about their health. And within this, we extend the services such as the care of environment, ensuring environmental cleanliness, and making sure that communities understand that they are responsible for ensuring a healthy environment moving forward. So now the benefits of this is, I say, we are becoming more cost effective. We are becoming more impactful because you integrate the services, you see the communities and the benefit at and go with all those services coupled together. Yeah, thank you, Bob.
Can you talk a little bit about how the migration patterns in the pastoral communities changed a little, and how Amref has kind of adapted our programming to meet those those migration pattern changes?
Yeah, sure. So the way pastoralists thrive is that they tend to migrate from one area to another area, looking for pasture and water for their animals. So in circumstances when there is drought or any other adverse climate effect, then those communities tend to move. So Amref has done a very innovative kind of an approach whereby, first of all, we have done mapping of the migration routes. And by mapping of those migration routes, we are able to spot where naturally communities settle, either because that place is at an advantage in terms of it doesn't flood, or when it rains, then it's easy to settle over there. And through that, then we have introduced container clinics. Container clinics where when they settle there, then it is so easy to move the health services and to address their needs where they settle. And we are doing that, as I said, together with the veterinary services and the environment services, so that when we move in, we address the entire package of care altogether. So that's something which we are developing and we are moving. We are trying to even put electronic data system that can be able to call in other services that are needed in such circumstances of migration. We are also working and extending the services to other sectors like security to ensure deconflicting of those settlements, because as people move, then there are issues around developing conflicts with the communities which settle along those pathways. So those are some of the things which we are doing, and we are working to really refine this model and make it even sharper.
Thank you for that. Another question too for you. We've seen a lot more outbreaks around cholera. Maybe you could go, it just feels like in the last year, there's been more cholera outbreaks. Maybe talk a little bit about the connection between the flooding and why we've seen so many across Africa or sub-Saharan Africa, so many cholera outbreaks.
Indeed. And Bob, if you just look at the way climate change is affecting people in terms of health, first of all, you can classify it broadly from the communicable diseases and non-communicable diseases. And most of these diseases which are communicable, the ones which jump from a person to another or from an animal to a person or the other way around, are either vector-borne. So there is a vector like mosquito or any other vector which carries those disease pathogens. Or it is a disease which is either waterborne, it is transmitted by drinking contaminated water or something like that, or whether it is water-related, that is a matrix of water within that. If you just perhaps wash yourself properly, you are able to control trachoma. So in incidences where we don't have enough water supply, it means that then trachoma is likely to spread in such kind of circumstances. So if you look at it from that broad perspective, Amref has been able to think through the process of, first of all, mapping the kind of diseases that are actually climate sensitive. We are working so hard to ensure that we have clear data and predictions of where these diseases are likely to occur, should there be either a flood or should there be a drought, because it's either two-way. And out of that, then we are moving together with the governments and other stakeholders to develop a preparedness and response plan. And that allows us space should a disaster hit then we have some latitude to move in without a lot of stressors in terms of logistics, in terms of sourcing and all that, yeah? So, but moving forward, then we are working on systems that ensure that now we build resilience. I spoke about one, which is around early warning systems. The second one is generating evidence of where these conditions are likely to hit, how they are likely to hit, and what is needed to address them. And above all, building the capacities of the health workforce so that they respond effectively when it comes to such kind of incidents. So those are some of the things that we are doing and innovatively communicating to communities that there is potential for this kind of danger. Creating that awareness. Awareness is so important so that should it strike, then they are ready and they know exactly what they are supposed to do. Yeah.
Thank you. I have one more question for you, and then we'll get to James. Recently in the United States, there was a first case of malaria reported in Los Angeles. So there's a lot of questions of how is climate changing or affecting or expanding malaria, dengue fever? You know, if you could make a couple of comments on that, because I think it's something we're seeing much more in the newspapers in the United States.
Yes, and that's a scary report because that's just one incident, and it's likely to turn out that malaria could spread widely where it wasn't. Right now, in Kenya, we have already seen the migration of malaria patterns. Randomly, it was concentrated in the lowlands, but right now we see these increasing incidences being reported at the highland areas. Within this, there's a mix of, first of all, the mosquito vector being able to thrive in areas where it could not thrive. That is the first thing. Then when there is flooding as a result of climate change, we see the vector being able to multiply for a longer term. When there's no water, mosquitoes don't multiply, right? And then there are some findings which are actually quite interesting, like when it is warmer, the mosquito is able to fly 6 kilometers further from where it could have flown should it have not been warmer. So, and this is just one example that I'm giving in Kenya, including like the emergence of new vector transmission mosquitoes, such as Anopheles stephensis, which is so agile because it's capable of transmitting multiple pathogens all the same. So this is Kenya, and it doesn't exclude Europe or America, where it is cooler. All what is needed is just the pathogen, Plasmodium, and then a mosquito, which is ready to transmit. And then we are going to see all these becoming outbreaks. Now, the danger is, should that happen to populations that are not immune to malaria, then we are going to have a public disaster. So my conclusion is that indeed, whether it is dengue, whether it is chikungunya, which are actually spreading to wider areas, whether it is malaria, we all need to start coming together and asking ourselves the question, what should we do to ensure that we don't get into a situation where we are getting pandemics as a result of vector-borne diseases driven by climate change?
Thanks, Martin. We'll move over. Thanks for all that time. We'll get back to you in a little bit. But want to introduce James, who is our WASH program manager from Tanzania. He's been working on some really innovative projects to combat climate crisis and really kind of focus on the mitigation aspect of it. James is working in Dar es Salaam, which is the capital of Tanzania. James, over to you.
Thank you very much, Bob. Thank you all for attending this discussion. I'm here to discuss a few lights from Tanzania on the innovation of fighting against climate-induced health crisis, but focusing on the how have we managed to increase the footprints in mitigating the climate crisis through producing the briquettes from the waste. In my backside, you may see the banner which written Takanimari in Swahili. So Takanimari means waste is wealth. That's when we shall concentrate our discussion today. So Amref Tanzania has already been touched base on by Martin. We have been working with the government for the past 60 years now. And mainly we are supporting the government to deliver the health systems under the social determinant for health with the new strategy that we are now supporting the government with. We are supporting the government initiative in order to reach its universal health coverage. But also the target of Amref in Tanzania is to ensure that we reach the last miles, the marginalized community, and the vulnerable population to access health services within the community. So the climate crisis, the mitigation measure that we are going to discuss here is more targeting the last miles community. So before going further, we had some informed challenges that led us to have this innovative project for bringing the energy, renewable energy to the community. In Tanzania, and the specific location is Dar es Salaam city, the capital city of Tanzania, where we have a population now of more than 6 million people. And the growth rate is more than 2.1% per year, which is very high growth rate. The projection indicates that in the next 20 years, the city of Dar es Salaam will be one of the mega cities and will host about 12 million people. So we need to have a number of mitigation and strategies to make sure that we live within that changes. We have high big urbanization in Dar es Salaam, more than 30%, whereby the unemployment rate is also very high, more than 55%, 55 to 60%. So we, as a development partners, NGO, we are working with the government to ensure that our community are getting the service they are needing. Saying that, there is a great increase of the cooking energy for people. As of current, more than 80% of the community in Dar es Salaam, they are using charcoal. As we all know that charcoal has a lot of negative and health impacts to the people. So it leads to the deforestation and a lot of indoor pollutions. So in a nutshell, I can share the health and environmental impact of the charcoal that we, after sitting with the government, we discussed extensively how can we manage the situation in the slum, and the government and Amref and the other partners, we came up with the very innovative approach to produce the charcoal as the alternative energy for the people. So as I said, the indoor pollution has been a big case because more than 50 million tons per year has been produced as the carbon dioxide, whereby 20 million of this carbon has been produced to the atmosphere and they're creating the global greenhouse gases, adding to the air. But also the indoor pollutions, it has been an increasing case in the slum, whereby a number of people have been getting infected from non-communicable and communicable diseases, which now we can find a lot of cases like lung cancers. You can find a case like heart diseases and a stroke, which were not common in our country, but also in Africa. So this has been all accumulated by the increase of pollutions, both outside and inside, and heavily contributed by the use of charcoal. We have also very big threat on biodiversity, in terms of the loss of biodiversity, but also the degradation of our biodiversity. We are registered about 0.5 million acres of forest has been lost per year in Tanzania. And as you remember, Dar es Salaam is almost consuming more than 50% of the charcoal that has been produced across the country. But also the projection 2030 is that there will be more than 70 million hectares will be lost because of the tree cutting deforestations. We also registered quite alarming cases on soil degradation, especially the quality of soil degraded from the erosions. Because once you cut the tree, then you get the soil open. When the rain comes, the erosion takes place. But the water resources has also been heavily degraded due to the pollution, and the rainfall that is now unpredictable. This takes the case like what Martin has said in Kenya. This includes drought and unpredictable rainfalls across the country. So this is the case that we have worked with the government and try to see how can we come together and try to mitigate, if not to adapt, at least to mitigate the situation. So the briquette, that's the alternative energy source for cooking. That will replace the charcoal, which is destructive to the environment, destructive to the health. And we are now coming into supporting the government and the community to live within that changing of environment. As of now, we have reached more than 350,000 people in Dar es Salaam alone with the briquette services. We have engaged the community to produce this briquette, in some part of the region. We are putting the number of measures to ensure that people are well aware of the briquette and they can adapt to the briquette use so that there can be more resilience to the multiple effects caused by charcoal. 3 outcome that the project has already registered is that we have seen a very great impact and a reduction of health cases reported across the region. We have registered more than 80% of the diseases that has been reported in the community, especially the diarrhea and the respiratory diseases. This has been mostly contributed by the solid waste management, which were uncollected in the street. And as I said, more than 50% of the waste in Dar es Salaam are not collected to the dumping site. But also we have registered a very big and job security. So this project has also contributed significantly to create jobs for more than 450 youth and women who are mostly affected by the change of environment. But also the people, especially the youth, has been very much engaged in the supply chain or the business chain of the briquette. So we have counted a very big contribution of job security. The climate resilience is, as I said, it's the cooking energy that replaces the energy that is very polluting the environment. We have seen how the change at the community level, at the household level has been registered, and we are continuing registering the changes on the ground. Here I have the briquette for those who haven't yet seen the briquette. It's look like a charcoal, but you can see it's in a foam pallet. And I will talk how have we managed to support the community to bring this briquette in the market so that it can conserve the environment, but also create a lot of other benefits. So normally the briquette is made by the food waste and the agriculture waste, just the food that you are you are eating in the kitchen, the leftover of the food, that's what we are collecting, and make sure that we make the product out of it. At the generation point, we normally advocate to separate, to do the sorting, because there are some waste which are needed for making the briquette, and some of the waste are not needed to make the briquette. So we do the separation, which is key for solid waste management process. And the wanted waste, they are normally taken to the carbon machine. We support the community to do carbonization so that you take out the carbon content, which could add up to the increase of greenhouse gases. And then the wanted material normally binded by the binding agent. In our local context, we normally use the cassava polage, or you can use clay soil. This is the form of the binding agent that we normally use to make the charcoal. Then the solution normally taken up to be mixed with the water and go into the briquette machine for stirring and make them to be more homogeneous for making the briquette. Then it goes to the dry machine where it takes about 24 hours, whether at the open sun or the dry chamber machine, which has some temperature to make the briquette to dry, and made available to be packed in different kilos, depending on the requirement of the customer. So we're normally supporting them to pack in 1, 2, 5, 10, or 15 kilos, and then it sold it to the market. So interestingly, with this product, is that most of the women are preferring to use this briquette more than the normal charcoal. This is because the briquette has some advantage over the normal charcoal. The briquette has been registered by the government vocational institution that it has very high caloric value. It has very high efficiency. When you burn it, it takes almost 80 hours compared to the 3 hours when you burn the normal charcoal. But also, it's less cost effective, very cost effective compared to the other energy sources. At a household level, they can spend only 0.5 USD per day for cooking a meal of 5 people to 6 people. Versus you can spend almost 2 USD per day for cooking for the same number of people in the house. So you find that it's a saving kind of approach that you are taking, and it is heavily adapted by the community. This briquette is also very, as I said, very efficient, cost efficient, but it doesn't pollute the environment. It doesn't have the char, the waste like the normal charcoal. Very acceptable, highly acceptable by the community, and also highly promoted by the government. Last year, when we were launching our new strategy, the regional commission and the higher government ranks, they announced and they very recognized the initiative that are taken within the country to produce these alternative charcoals against the alternative energy, which is the briquette against the normal charcoals. So, in a nutshell, we are supporting the government heavily to make sure that we reduce the climate-induced health crisis in Tanzania. We are aligning with the government systems, strategy, vision, and the directions to ensure that the climate resilience is making and taking advance in the country. We are supporting the government initiative on clean cooking energy. It has been very much advocated by our country, our nation.
James, you accidentally muted yourself.
Yeah, we are advocating for our national priorities and strategies. The president of the country has been championing heavily on the use of clean energy, and the charcoal is one of the clean energy that we are supporting. We are looking forward to partner with more players in the sector to establish at least 4 industry, charcoal industry in the country, to make sure that we are reaching more than 8 million people across the country. We are investing to establish some small industry to ensure that people are engaged more on this business. And we are working with the government vocational trainings to ensure that we also spearhead the knowledge and the practice within the country. So that's the innovation that we have made, and I submit. Thank you for listening.
Thanks, James. Also, I just think I want to add, I'm not sure I heard, but haven't we created almost about 140 full-time jobs and about 250 part-time jobs, which I think is pretty incredible. Not only, I think the economic portion plays, such an important thing. And obviously, I think it brings people understanding the importance of climate change and how it can help their everyday life. So I thank you for that. But James, I'm going to have you maybe address a little bit about how you in Tanzania and your team is addressing climate resiliency in Tanzania.
Hello? You mean how are we addressing climate resilience?
Yes.
Yes, as I mentioned, we have a number of initiatives that we are taking. I've discussed the one on the charcoal making initiatives that is ongoing on the country, but also we have another project and initiative. For example, we are now making the use of renewable energy, the use of solar systems in areas for community water supply and sanitation. We're also championing the use of renewable energy, for example, solar systems in healthcare facilities to ensure that the resilience are taken into its scale despite under the change of climate. So we also working with the other sector, for example, the agriculture sector, to promote the use of smart agriculture so that they can sustain their agri-products while surviving to the climate change. We are working with the forest department to ensure that there is education and the like. So we have a number of projects and initiatives that we are connecting with other players within the country to ensure and understand the concept of resilience and living within the resilience. Yeah.
Thank you. Thanks so much, James. Martin, would you mind answering that same question?
Come through again, please, Bob.
Would you mind, you kind of touched on it before, about how we're directly addressing resiliency in communities, but would you mind kind of adding a little more to that?
Yeah, I would like to add the voice to what James spoke about. And James put it very clearly. By the way, if we cut down the emissions that that come out of cooking using dirty fuels, and especially firewood, number one, we have a chance of protecting our communities against the respiratory diseases, and we have seen that working. So this is one of the projects which I would simply say that if we get it right, then we will be able to address a very, very big problem, because it's not only in urban areas, but also in rural areas where we have such kind of challenges. So by really transitioning to cleaner energies, and we have solutions in terms of like recycling of waste, like what James spoke about, then we should be very good. And that's one. Then the second one is like really thinking about how best we can engage communities to ensure that the way we produce our own food moves from overdependence of ranch-scale farming to transitioning to small-scale farming manageable at the household levels. And this brings the entire idea of how to reuse wastewater, how to ensure that we are becoming efficient with water and recycling that. So that's another good idea which can happen very strongly at the community level. And then there's a whole big picture around the technologies that need to be introduced to ensure that whatever we are doing, we are not introducing greenhouse gases into the environment again. And here we are strongly also promoting the transition to solar energy, knowing very well that Africa has a lot of solar. Then how do we best work with communities? How do we best work with the health systems in the remote areas to ensure that there is that last mile connectivity of electricity, now not using dirty fuels, but using cleaner energy? So there's a whole big spectrum. If you divide it, you'll see some of them are actions that are related to adaptation. That is, we have the problem here, what do we do about it? And then there are other actions which are like, how do we make sure that we don't exacerbate the problem? And those are the mitigation measures. And I see a lot of beauty in the kind of work which we are trying to do because it's addressing the two spectrums. And that is what is needed to ensure that we create proper resilience.
Thanks, Martin. Maybe you could answer this, or James. I mean, one of the things like we hear is engagement of community a lot and how we work with communities. But I would be really interested in either one of you talk about when you went to the community for the first time and said, we're going to create briquettes out about this that are going to make your energy cheaper, but it's going to come from waste. Like, how did you convince the community that this idea, now that it's been around, but how do you convince the community going to saying something so dramatic? I know I hear it and go, really, what would my first reaction be? I would love to hear how you convince the community to make that kind of dramatic change, even though all the data is there.
Yeah, thank you, Bob. Nice question. The community, I think, normally we have different community engagement structures because also we're working with the community health workers, but also with the extension health workers. And we use the approved or the evidence that we have in our hands. Normally, we take the sample, for example, in the community meetings. We discuss with the community, analyzing the situation, because the community themselves should know the challenges they're facing as of now. We just facilitating them to unpack the challenges, especially those brought by the climate impact. We inform them that there is an alternative way of earning, because at the end, the community, they do deforestation because of gaining income or supporting the living system. So it's a way that we informed them that there is an alternative way of income generating activities more than just doing the deforestation. But also we demonstrate the way that they can save is by using the alternative energy source. As I said, it has a lot of saving. We demonstrate how the cooking energy is more efficient. They can use a little in a long period of time. We demonstrate how they can save over a year if they use the alternative energy, but also we remind them the future scenario if we are not doing anything within their living. Yeah.
Great. I mean, part of it, you said it really early on, we've been working in Tanzania for 60 years. So when you bring new ideas and you've been working that long with the community, you have that trust where they're willing to kind of, okay, this is really different, but we trust you, we know you, you guys have been working with our community for so long. So thank you for that. I'm going to pass it over to Emily and we'll let folks ask some questions directly. I think everyone's tired of hearing me ask questions. So Emily, do you want to take over?
Sure, yeah. Just checking, there's a new. Okay, so I know that some people put some questions in the chat. Also feel free to raise your hand or come off mute. I guess you can raise the hand reaction if you have a question directly. But I know there was a question in the chat about how affordable this product is and how the community has responded to that. And if you could just answer that one more time, make it more clear. James or Martin, go ahead. Can everyone hear me? Or
James, I think the question is for you. What is the affordability? If you could repeat the affordability of using a briquette.
Yeah, thanks. I think I mentioned that using the briquette, the household with 5 to 6 people, they can spend hardly 0.5 maximum per day for cooking their food from morning to evening. But if they were using the normal charcoal, they spend hardly $2 per day for cooking for the same number of people in a day. So it has a lot of saving, almost 70% saving per day.
Thanks, James.
and that's
It's
in
incredible.
local currency.
I converted to USD 0.5 to 2. Yeah.
So 50 cents versus $2.
Yep.
Okay, and then in terms of Tim had asked about elements of the briquette, and I know that household food waste was put in the chat as an answer, but also there was a follow-up question about does this require waste separation, for example, removing plastics?
Yeah,
James, did you hear me?
I can help Mturi to rephrase the question. Mturi, they're asking whether they have to do waste separation, which I think they do. Maybe you can explain that.
Yes, thank you very much for your question. I mentioned in my discussion that in the solid waste management, the waste separation is a key component. And this normally is done at the point of generation, where at the household level or at the point of collection, where the waste are collected. So when we are looking for the materials to make the briquettes, we normally separate the waste. The wanted materials, that's when we are taking to the industry, and the unwanted. Unwanted may be like grasses, which is not used for brick making, or plastics, which is not currently, we are not currently doing it for briquettes. But the plastic are on the way to be also recycled into another product very soon. Yeah.
Great, thanks, James. Does anyone from the audience have any more questions or anything you'd like to ask directly to Martin or James?
Yes, Richard, go ahead and unmute yourself.
Hello. It's possible to argue that perhaps in England, climate change has some advantages in the sense that we have a flourishing wine industry now, which we never used to. Are there any advantages that either of you can think of in the climate change in Tanzania and Kenya? Is there anything that we can benefit from?
Yeah,
Maybe for Tanzania, I may start, and then Martin will also add up from Kenya. But I have also many colleagues from Tanzania. They can also add in on the advantage. One of the advantage that I can see here from Tanzania is the innovation. The innovation part. Climate change has reminded us that we need to be very innovative to sustain our life. So there are a lot of innovation, but also the partnership. We have been brought a lot of partnership through the climate change, because climate change cuts across several sectors and sections. So it's a way that we need to work together and reach the common goal. That's the advantage I can see.
Great answer, James. Thank you.
Yeah.
I don't want to spoil that answer because we are in a
Nailed
crisis.
it.
Yeah, and the reality is that where the crisis is a net taker. So if we could have kept it away, we would be better. But then there are some things which are coming through, and they are helping us to think better, innovate, and become smarter. Yeah.
Dean, did you have a question? I saw your hand went up. Oh, you're on mute.
Yeah, thank
You're on mute.
yeah, thank you so much.
Oh.
Good evening. This is Edward Majan.
Yeah,
I have two
could you
questions I
expand?
would like to make.
Oh, hold on 1 second, Edward. I think Dean is just going to ask a question first, and then we'll let you go.
Okay, could you expand a little bit on things that you're doing to help the health sector adapt to have a smaller carbon footprint, which is resilience and adaptation, but it's also it's budget saving or cost saving. Many development projects have actually increased the carbon footprint and increased the budget of the health sector by bad construction, eliminating typical tropical hospitals and replacing them with places that need electricity and air conditioning. Is Amref doing anything to help the health sector adapt to decrease their carbon footprint and decrease their budget?
Martin, you want to take that question?
Yes, I can come through very quickly. Yeah, so yes, we are doing that. And so the first thing that we are doing is supporting ministries of health to undertake vulnerability assessments. And after that, then we are promoting solarization of health facilities, putting solar to address the issues of electricity at that level. And then the second thing is around the smart procurement. So we realize that we have to be very innovative in terms of bundling procurement, ensuring that if a vehicle has to move, it doesn't have to move with vaccines only, but we couple that with other commodities and thereby cutting the kind of carbon emissions that are being emitted as you transport that. And so there are many more kind of think through processes that we are engaging ourselves, including the cleaning services, the healthcare waste management services at the hospitals, ensuring that it is segregated and the treatment is actually centralized in a way that if you are supposed to incinerate, then it is within the controlled measures, and more specifically also transitioning to what we are calling non-burn technology. So you don't have to burn waste, you can microwave or autoclave. So those are some of the innovations that we are dealing with just to make sure that the greenhouse gases emissions are reduced.
Thanks, Martin. And Edward, I think you had a question as well.
Yeah, thank you so much. Thank you for the chance. I have two questions, but I have a single question to everyone can respond. Let me know if I'm audible enough.
Yes, we can hear you.
Yeah, thank you. Yeah, I was trying to interrogate myself as we embark on the journey of the building the climatic resilience. I was trying to understand the clear distinction, or what is the real difference between the natural response of these disaster and calamities that we used before and this new concept of building climate resilience. Anyone can respond. Secondly, I have the question from someone from Kenya and someone from Tanzania as well. From Kenya, can you please comment on the position of some of the vulnerable population or group, do we leave them behind, or can we integrate them into this climate resilience building? We have some vulnerable population, how best we can help them and how best we can integrate in this journey of building climatic resilience. Yeah, again, from Tanzania, first and foremost, I would appreciate the initiative. I was trying to ask myself, are we the pioneers of carbon dioxide production? And I'm trying to ask, secondly, I'm trying to ask myself, you are trying to focus on urban, on urban here in Dar es Salaam, but from the community and our experience in the rural Tanzania, most of the people, they're using charcoals. We call it kuni, and there is a significant number of people that they are using charcoal in their routine compared from those urban. And urban, at least they have this called gas that they are used. And how many percent they are using charcoal in compared to rural Tanzania? Did you meet the focus, or how can you convince us if they really targeted population, while in a context-wise, in rural Tanzanians, there's a lot of people that they are using these charcoals, and to some time they succumb some health-related condition due to the use of this. Thank you. I submit.
And then maybe James and Martin, this will be our last question because we are at time. So if you guys want to answer quickly, and then if there is a question that has not been answered, feel free to put it in the chat, and then we can follow up with James and Dr. Martin after this call. Over to you, Martin and Mturi, if you just want to answer quickly any part of the last question.
Yeah, quickly from Tanzania. The project started in Dar es Salaam, but we are planning to go across the country. In Dar es Salaam, 80% of the population use charcoal. That we wanted to convert them to use briquette and other renewable energy, clean energy. For rural, we are going for rural, and we are strongly positioned to go in rural to make sure that the rural community are also changing, because that's where the deforestation starts. And we are positioned to use the charcoal dung to produce the biogas at the household level. So this is the coming project. Just keep in touch. We'll let you know the progress.
Sure. If I come in, we cannot afford to leave anyone behind. So if the framing was not correct, those who are most vulnerable are actually the ones who we centralized in terms of our intervention. Yeah, and just really keeping it short, we don't leave anyone behind. Yeah, thank you.
Amazing. So if there are some questions that have not been answered today, please, again, feel free to email me or an Amref staff person in Canada or the UK. We can make sure that we send these questions on to James and to Dr. Martin. We did a lot of talking about briquettes and amazing innovative projects. A lot of conversations on the things that we're doing to build resilience and climate change. We are also working towards helping respond to the climate crisis with the Kenya flooding. So if I would have my colleague Ray put in the chat, and I think the UK, if anyone is interested in supporting the relief efforts that are going on in Kenya right now with mobile clinics, helping provide really needed resources due to the flooding that's happening in Kenya, there are links for the US and the UK right now posted in the chat. We'll keep you posted on a lot of this climate work, and I will be sending out this recording to the people in the US, and the UK and the Canada offices will do the same. So thank you all very much for joining us today. Please keep your questions coming, and we look forward to continuing these conversations. James and Dr. Martin, very much appreciate your time, your innovation, and sharing your work with our audience.
Thank you, James. Thank you, Martin.